respected chairperson and learned audience. Assalamu alaikum. Welcome you all to my presentation. It is titled as Barriers of Achieving and Maintaining Glycemic Target Among Type 2 Diabetes Mellitus Patients on Insulin Therapy. We all know that diabetes is on the rise globally. About 90% of these patients suffering from type 2 diabetes. The key objectives of diabetes treatment are to reach the glycemic target, avoid long-term complications, and maintain long-term glycemic control. Insulin is regarded as the most effective therapy even when oral anti-diabetic medications are inadequate. However, diabetes is grossly uncontrolled all over the world, including Bangladesh, even in patients taking insulin. Studies conducted in Bangladesh 2019 showed that about 82% people have uncontrolled diabetes in Bangladeshi population. So this study was conducted to find out the barriers that are associated with failure of insulin therapy. It was an observational cross-sectional study conducted in Department of Endocrinology of BADAS IDF Hospital from March 2020 to August 2022, and patients with insulin therapy having uncontrolled diabetes mellitus were selected as the study population. Sampling method was convenience sampling and final sample size was 384. Patient age above 18 years of old with type 2 diabetes mellitus on insulin therapy and HbA1c level greater than 7% were selected in this study. Patients with type 1 diabetes mellitus and other secondary cause of diabetes mellitus not on insulin therapy and pregnant women were not selected in this study. These are the variables were used in this study. Ethical clearance was obtained from Institutional Review Board of BADAS IDF Hospital and data were analyzed by SPSS version 25. Data were presented as frequencies and percentage for categorical variables and mean and standard deviation for continuous variable. Independent t-test and man-Whitney u-test was used for continuous variables. P-value was less than 0.05 was considered as a statistical level of significance. Socio-demographic profile of this patient revealed that mean age of the participants were 56 plus minus 10 years, with most of the participants was above the age of 60 years. Female were the predominant population in this study and most of the people were hailing from urban area. Among the diabetes patient, the most frequent comorbidity were hypertension, followed by diabetic retinopathy, chronic kidney disease, coronary artery disease and cataract. As obesity is a global problem, in this study which also reflected the prevalence of obesity and about 74% patient were obese and the mean BMI was 27.3 plus minus 2.90. The mean duration of diabetes mellitus were years and duration of insulin therapy were 4.4 years. So that means that in our population it requires 8 years for initiation of insulin therapy in diabetic patients. Fasting plasma glucose, postprandial glucose and HbA1c was in the higher level in our study participants. Most of the patients were taking insulin and oral antidiabetic medications and only 23% patients were taking only insulin. Among the insulins, premixed insulin were the prevalent type of insulin, followed by split mix, basal bolus and only short-acting insulin. Syringe were the most common form of insulin application device for our patients. So what are the barriers we have found in our study? Among them, only 38% people has knowledge about target plasma glucose and insulin dose adjustment, and majority of the people don't follow their prescribed diet chart or are irregular in their physical exercise. Self-monitoring of blood glucose is an important component of good glycemic control, but majority of the people did not follow it regularly, and people did not titrate their insulin dose due to the fear of hypoglycemia and weight gain. We compared socio-demographic and clinical parameters with their relation with HbA1c level, among them obesity, premixed insulin, users and irregular SMBG, irregular physical exercise, no education on target plasma glucose and insulin dose adjustment, and not following the diet chart were significantly associated with a higher HbA1c level of greater than 10%. Another reason for poor glycemic control are insulin omission. where 54% patients have some form of insulin omission, such as some people omitted insulin one dose or totally, and some people omitted insulin totally. The major reasons for insulin omission were fear of hypoglycemia or one episodes of hypoglycemia, followed by insulin cost, convenience of carrying needle and syringe, and pain, bruises, itching at injection site. Patient who omitted insulin has higher HbA1c level. Also, syringe users also having higher HbA1c level. Among the participants, the association of different parameters with insulin omission, there was male gender, rural residence, irregular physical activity, no education on target plasma glucose, and no education on insulin dose adjustment and not following the diet chart were significantly associated with insulin omission. So in conclusion, this study revealed that lack of patient education regarding target plasma glucose and insulin dose adjustment, irregular SMBG, and poor self-empowerment with regard to insulin dose adjustment acts as factors in poor glycemic control despite on insulin. Any form of insulin omission is also a major reason for poor glycemic control. Patient omitted insulin mainly due to hypoglycemic episodes, cost of insulin, inconvenience of carrying needle and syringe, and dependency on caregiver for injecting insulin. Overall, there are some areas where adherence of respondents is lower than optimal. This is especially true in the areas of adherence to diet and exercise. So I'd like to recommend to initiate nationwide awareness building program to disseminate the basic knowledge of controlling plasma glucose for diabetic patients, especially structured diabetic education, emphasis on following diet chart, doing regular physical activities, self-monitoring of blood glucose for insulin dose titration while preventing hypoglycemia. During choosing of insulin delivery device, we can choose pen devices because it leads to better adherence to therapy. So thank you all for patience hearing.
Thank you, Dr. Aminul, for beautiful presentation. Next.